my name is Monique Gomez. I'm a student at South Texas College and I'm going to be performing hand hygiene. To start out, I'll make sure that I don't have any jewelry on. If I did, I would place to the side. Then I'm going to go ahead and I'm going to get the alcohol-based rub and I'm going to check the expiration date. This has not expired yet, so it's good to use, and I'll check for the recommended amount. That's typically between 1 and 3 milliliters. So I'll go ahead, place the recommended amount into the palm of my hand, and I'm going to make sure that I rub hands together, covering each area of my hands and fingers for at least 15 seconds and until the product is dry. So it has been 15 seconds, the product is dry, my hands are good and ready to go. Now I'm going to do hand hygiene using soap and water. I would go ahead, check the soap for the expiration date. This has not expired, and I'm going to go ahead and look at and see if there's a recommended amount to use. So to start out, I would make sure that my body is not touching the sink, and I'm going to go ahead and adjust the water, making sure the flow rate is good to prevent any splashing. I do want it warm, and I do want to make sure that I'm keeping my hands below my elbows. So my hands are wet. I'm going to go ahead, get a pump of soap in the palm of my hand, and I'm going to go ahead and use a firm circular motion to wash my hands. I do want to cover the palms and the back of my hands as well as the fingers. Make sure that I'm washing each finger. And then after I wash my hands and my fingers, I'm going to go ahead and make sure I wash at least 1 inch above the area of contamination. I do want to make sure that I'm washing under each fingernail. So I'll go ahead, use the opposite hand to do so to help me get under each fingernail. Once it's been 20 seconds and I'm done washing all areas of contamination, I'm going to go ahead and rinse. Once all of the soap is washed off, I'm going to go ahead, grab a paper towel, and I do want to dry from the fingertips down to the forearm. Fingertip down to the forearm. I'm going to get the last napkin, I'm going to use it to turn off the water. And we're done with hand hygiene. So now we're going to go and do PPE. Okay, so here I am and I'm ready to don and doff PPE. The first thing I would do is to check the medical record, make sure that I know the proper precautions to take for the patient. I'm going to go ahead and place a hairnet on just to keep the flyaways nice and covered. I do want to make sure I'm covering all of my hair. Alright, so now I'm ready to put on my PPE. Okay, so the first thing that I would do is go ahead and perform hand hygiene before putting on the PPE. Putting the recommended amount, and then I would do so. Make sure that I am doing the correct hand hygiene for 15 seconds, which I did over there. For time purposes, we will go ahead and get started. The first thing I will put on is my gown. I'm going to take the gown, I do need to make sure that I'm tying at the neck. And I'm also going to tie around the waist. The next thing I will put on is my mask. to grab it by the loops. I do want to make sure that I'm fitting the mask to my face and pulling this down under my chin to cover my jaw area. Then I can put on my face shield. And lastly, I will go ahead and put on my gloves. I do want to make sure that I'm bringing the gloves over the gown. And again, I'm going to want to make sure I'm putting the glove over the gown. Okay, so now I'm ready to go see the patient. Now docking the PPE. To remove the PPE, I would do so at the doorway, and I'm going to go ahead and start by removing my gloves. I would grab and bunch it up and make sure to invert the glove when I am pulling it off. I'll invert into the gloved hand. Then I'm going to take my ungloved hand with the finger, and I'm going to insert it into the glove like so and pull that down. I will invert the glove, making sure to roll it into a ball. Then I would place in the proper wastebasket. After that, I would go ahead and remove my face shield. And I would place in the proper wastebasket. Next, I'm going to remove my mask, dispose of it in the proper wastebasket, and now I can go ahead and remove my gown. I'll start by untying the neck and untying the back. Okay, so now I can go ahead and bring this arm inside the gown, making sure to only touch the inside. We'll bring down, and then I'm going to invert the gown like so. And I'll make sure I'm only touching the inside. I'll roll it into a ball away from my body and dispose of it in the proper wastebasket. I'll do so again as well for the hair covering. Then I would go ahead and perform hand hygiene again, using the recommended amount. Okay, so proper hand hygiene is an effective way to prevent the spread of organisms. And so it may be, if it's performed correctly, then it's extremely useful, especially if it's performed at the right time. And then for proper use of PPE, and that's really good for infection prevention and control. We do want to let the patients know that PPE helps protect not only them, but the healthcare providers as well. That's it.